Been diagnosed with cancer? Let me tell you what to do. So this is Dr. Joe Brown. When I was 22 years old, I was diagnosed with terminal cancer. I was told I had 3 to 4 weeks to live. So this is a personal subject for me. And when I was diagnosed, we didn't know what to do. We didn't know who to call. We didn't know where to go. So let me give you a beginner's outline, some very crucial key points of what you need to do when diagnosed, because time is not on your side. And the things that you do now will make a huge difference in the outcome of your case. First, don't panic. Don't sit home and panic. Easier said than done, but don't do it. Also, don't sit home and do nothing. These are probably the two biggest mistakes that I see from every patient that I've ever had in my entire practice clinical history, is people either panic or they give up and they say, been diagnosed with cancer, why am I going to do nothing? Or they don't know what to do and they end up sitting home. All of that is a huge, huge mistake. So let me go over some things that you do need to do, and you do need to do them right now. You've probably been diagnosed, and you probably were in your primary care physician's office, and you either did a series of blood tests, laboratories, or scans for some problem or concern, and they end up finding cancer with you. Now, the next thing you need to do is you need to get set up with a medical oncologist. Now, what is a medical oncologist? A medical oncologist is a physician who specializes in cancer. He's the guy or she's the person who wants to make sure that you are doing the right imaging, the right blood work, and the right tumor markers to make sure that we can not only detect that you do have cancer, determine which type of cancer it is it hormone related, and what to do about it. Now, there's going to be a time period of your primary care doctor or your regular doctor that you're seeing until you get to your actual oncologist. Usually a good week to 2 weeks goes by before you actually get into your medical oncologist. So what do you need to do? Make sure with your primary care doctor you do the following. I want you to get as many blood work in terms of CBC and chem panels done, scans of any kind, whether that be an X-ray, a CT scan with and without contrast, or an MRI done. And if your cancer is hormone related, get the tumor markers run or the hormone panels done before you actually get into your oncologist if you can. Now, I'm not asking you to self-diagnose yourself and make all the decisions yourself to get all of that done. But if you have all that stuff done, once you get to your oncologist, there isn't going to be another week or two that goes by while you're waiting to get all this stuff done, because you've already got it done and he can look at it and they can get all that read and get you set up on therapy ASAP. That's crucial. Again, time is not on your side. Okay? Now let's talk about hormone-related cancers. Certain types of cancer, like breast cancer, prostate cancer, etc., those are hormone-related cancer. So there are certain therapies that we will do with you, both from a standard allopathic side as well as a naturopathic medical side. But then if your cancer is hormone-related, we will also possibly put you on hormone-related therapies, which will decrease the hormones that are making your cancer spread faster. Now let's discuss for a second standard allopathic medical doctors or therapy in contrast to naturopathic medicine. Okay? Standard or allopathic doctors are going to recommend essentially 3 things to you: chemotherapy, radiation, and surgery. Those are typically the 3 options, if not a combination of them. Naturopathic doctors, and you need to make sure that you're not just finding a standard doctor, it needs to be an oncologist. And with naturopathic doctors, you need to make sure that you are specifically finding a naturopathic doctor who specializes and works with oncologists, such as myself, or people like what I do. Because the therapies that you're going to be recommended from the standard side, you are going to be put on a chemotherapy regimen or a radiation regimen that is going to last for so many weeks, and there's going to be intervals between or certain times that we put you on that from the standard medical side. From the immunotherapy or naturopathic medical side, we are going to be doing certain immunotherapies with you. And these therapies must be done in conjunction to your standard allopathic medicine. Because if you do some of these therapies in conjunction at the same time, you will actually get rid of the chemotherapy or cause the radiation to not be as effective. Whereas if it's a different type of cancer, we will juggle or move these therapies on different weeks or different days before or after, or certain many days after you've had your standard allopathic therapy, so that we give you the proper immunotherapy at the proper schedule so that both therapies are more effective. And from not just my personal cancer experience when I was 22 years old, but from all the clinical years that I've spent in the hospitals, the cancer clinics, and my office personally, I will tell you that don't just choose standard doctors in therapy, and don't just choose naturopathic doctors in therapy, because you will be doing yourself harm. Make sure that you are choosing a doctor that is on the standard side as well as the naturopathic side and work together. In my experience, you will do better and you will get better quicker by using both together. I'm Dr. Joe Brown. If you have any questions, get in touch with us. Your health is in your hands.